Okay, and welcome back to today's webinar on laser therapy for dermatological conditions. My name is Dr. David Kanashko. I'm the Director of Education and Research here at BioFlex Laser Therapy in Toronto, Ontario, Canada. I want to thank everyone for joining me today for today's webinar. A bit of housekeeping before we start. This webinar is being recorded and will be available via a link that you'll be sent via email to watch again at your own convenience. And that goes for any future webinars. If you sign up and register, you will be sent a link at some point to watch the webinar if you're not able to tune in live with me on this day. But thereafter, it's archived into our downloads page on our website, which is password protected for BioFlex Laser Therapy users. I will be taking questions, so please type them in as we go along. I will get to those questions at the very end of the webinar, but I would prefer if you start your questions as soon as they come so I can look at them at the very end of the webinar itself. I have taken a bit of a sabbatical for the last couple of months with webinars, and I will be starting again every month, usually the Wednesday or Thursday just before our training here in Toronto. And I'll give you the schedule for the next webinars at the end of today's webinar as well. I have to apologize. I'm getting over a head cold. I have my tea with honey and lemon next to me, but I may need to clear my voice and it may sound a little off. But it's because I'm getting over this cold. All right, so let's start with today's webinar. On the agenda today, I'm going to talk about various topics. I can't cover all the different conditions that LLT can actually treat with respect to skin, but I'm going to try and cover some of the major ones that I have been asked to talk about many times in the past. I'll talk about skin rejuvenation, specifically the aging process of skin, like wrinkles and so forth. I'll talk about acne, herpes virus infections, vitiligo, hypertrophic scars and keloids, psoriasis as well. Now, remember that I've already covered alopecia or hair loss in another webinar, so we'll be covering that today. And at the very end of today's webinar, I will, in fact, have time for questions and answers. Okay, so let's talk a bit about skin aging. A few fun facts for you out there is skin aging can present even quite early on, as early as 20 to 30 years of age. Really, it oftentimes has to do with excessive sun exposure and genetic factors as well. Some of the common signs and symptoms associated with skin aging, as I'm sure you're all familiar with, is of course skin wrinkling, skin dyspigmentation, telangiectasia, which is spider veins. I'll stick to the spider veins, and reduced tissue elasticity. So these are some of the common signs and symptoms that you will see with aging skin. Now, at the histological and molecular level, there are certain features that include reduction in collagen content. This is really critical as far as LLT goes, because we know from previous research and many of our webinars have talked about the ability of light therapy to stimulate fibrocytes and fibroblasts, which of course helps secrete collagen. So this is one of the main mechanisms of action. And of course, there's reduced collagen in the aging skin. There's also fragmentation of collagen fibers, so the collagen itself is not of normal appearance, normal histological appearance. There is degeneration of the elasticity of elastic fibers within the skin as well. So you lose that elasticity; it becomes sort of more rigid, and oftentimes you'll see the appearance of dilated and tortuous dermal vessels like spider veins. Oftentimes you'll see disorientation and atrophy of the epidermis, so you might see the skin sort of sinking in and not, of course, looking as firm as a younger person. So I'm sure everyone recognizes this is a multi-gazillion billion-dollar industry, and low-level laser therapy is certainly a tool that can be used with respect to this. And I have some great case studies and research to emphasize and talk about this as well. So low-level laser or light therapy, LLT. Remember in the past I've talked about photobiomodulation therapy, which is sort of the newer term, or PBMT. I'll be sticking with LLT today, but again, I do want to emphasize that we'll be seeing more and more research that refers to photobiomodulation therapy as opposed to low-level laser or light therapy. And it has been shown to be effective for improving skin conditions such as wrinkles and skin laxity. Essentially, we know that LLT can increase the production of pro-collagen, collagen itself, and basic fibroblast growth factor, or BFGF, and proliferation of fibroblasts. The mechanisms I've talked about quite a bit in the past with respect to the ability to increase the electron transport chain and the production of ATP in cells. This is one of the well-established mechanisms of action of low-level laser therapy on cells. Let's get into some research. This first paper, published out of Australia, entitled The Use of LED, or light-emitting diode therapy in the treatment of photo-aged skin. The objective of this particular research was to assess the reduction in sun damage signs following a 5-week course of LED therapy and to assess the subject's perception of the treatment. Excuse me. I do want to emphasize that when we're treating the skin, especially things like aging and so forth, you will find that the treatment plans, the number of treatments, is much more extensive than other conditions that we're used to treating, like musculoskeletal conditions. In this particular clinical research trial, there were 13 subjects with wrinkles or lines in the periorbital or nasolabial region, so around the nose, and those presenting on a Glasgow scale photo damage grade of 2 to 3. They performed 9 20-minute duration light treatments, so you can see that the duration was quite long in this paper, 20 minutes, and they used LEDs. They used 633 nanometers, which is red, and 830 nanometers near infrared, affluences or energy density of 126 joules per centimeter squared for the red, and 66 joules per centimeter squared for the near infrared. The results, the majority of subjects displayed moderate or at least 50% or minimally slight response to treatment at investigator assessment. Treatment of the periorbital region was reported more effective than the nasolabial region. Can't say that word today, which is of course around the nose. They did a 12-week follow-up and found that 91% of subjects reported improved skin tone and 82% reported enhanced smoothness of skin in the treatment area. I do also have to emphasize that the effects of LLT are oftentimes carried many, many weeks, if not months, after the treatment, so you can still see improvement and lasting effects well after the end of the treatment plan. So let's take a look. Now, again, emphasizing that when you're using LLT for wrinkles, you will not see a dramatic shift of the wrinkles. You will see improvement, but of course it won't be anything like a surgical facelift, that kind of thing. If you look at the first case around the eyelid, the periorbital region, the closed eye, you can see the wrinkles. This is day 1, so before any treatment. And this would be week 12 after the 9 sessions. And if you look carefully, you can see a definite improvement in the fine wrinkles around the eyes. So this was with 9 treatments using red and infrared, near infrared. Of course, BioFlex uses pretty much the same type of treatment with respect to the red and near infrared LEDs. So you can expect very similar results using the BioFlex laser therapy system. Another view here, if you look carefully at the forehead and the wrinkles and the baseline, day 1, and then of course on the right, week 12, you can see clearly a reduction of the fine lines and wrinkles. You can see the major wrinkles, say at the brow of the nose here. There's not a lot of change, but if you look carefully, you'll see the finer wrinkles have disappeared, and that's because of the increase in collagen. When you're talking about larger furrows or larger wrinkles, Those are probably not going to alter too much with respect to LLOT. That would require something a little bit more invasive, like Botox or surgery. Oftentimes, people that use LLOT, they don't want to undergo such drastic or invasive type of procedures, and they're more than pleased to see reduction of wrinkles, even if it's fine line wrinkles, using something that's safe and effective, like LLOT. Another paper on the same topic, regulation of skin collagen metabolism in vitro using a pulse 660 nanometer light source. They also did a clinical correlation with a single blinded study as well. So I'm going to refer to the single blinded study. In this case, they chose a group of chronologically aged, photo-aged individuals. They received 12 LED treatments. Again, notice it's LEDs. Or a sham light control, so a placebo control over a 1 month period, and they did a split face study. So in other words, half the face received treatment and the other half of the face got the sham. 40 healthy patients were enrolled, 37 women and 3 men. Interesting demographics there, with a mean age of 44.9. So they used red light, 660 nanometers, and I must say if you're going to choose either red or near infrared, I would choose red. Power density, 50 milliwatts per centimeter squared. Total fluence or energy density of 4 joules per centimeter squared, and they treated, in this case, for 2 minutes and 40 seconds, so a much shorter treatment time, but they had a much greater energy density. And here are the results. So you can see the pre and the post. LED in the control. If you look carefully, the wrinkles at the periorbital region, and then post after the 12 sessions, you can see those fine lines and wrinkles have been, I would say, dramatically improved, or at least moderately improved anyhow. Whereas the control, to me anyhow, it looks like the person got more wrinkly, but I don't know, that's just me. So this definitely was a case where it showed that the pre and post 12 weeks showed fairly good efficacy. So overall, their findings were that more than 90% of individuals showed a reduction in skin wrinkle depth and surface roughness, and via blinded clinical assessment, that 87% experienced a reduction in the Fitzpatrick wrinkling severity score, that's quite a handful, after 12 LED treatments. Okay, moving on to acne. A few fun facts about acne. Acne vulgaris is a relatively common skin disorder, as you all know. Prevalence can be up to 90% among adolescents. Some studies have reported a comedone, yes, that's how you pronounce it, prevalence nearing 100% for both male and female sexes during adolescence. So the pathogenesis is still not 100% understood, but there is a consensus that involves very specific events, including hyperkeratinization, increased sebum production or oil production in the glands, and colonization of Propionobacterium acnes, we'll call it P. acnes for short, and excuse me, an inflammatory component. Okay, so when treating acne, on the left you can see the actual acne region. There's an infection of bacteria. The red is the inflammation. And what's commonly used to treat acne is a combination of blue and red light. We use red and near infrared. However, I do recommend also using blue light. Because blue light has a very interesting way it works, and I'll talk about that very shortly. So one of the mechanisms that, with respect to LLOT, is that blue light specifically, and red light to some degree, can excite porphyrins, which are generated by the bacteria P. acnes as part of its normal metabolism. These porphyrins are found within the bacterium, and when exposed to enough energy density of blue light and to some degree red light, it actually causes free radicals to form. So this is really referred to as endogenous photosensitizers. So they absorb light, and again I mentioned mainly blue, but to some degree red. and it stimulates a photochemical reaction that causes the generation of reactive free radicals and singlet oxygen species, and these are toxic to the bacterium. So actually what you're doing with this blue light is killing the bacteria. So by using blue light and then red light, especially for the inflammation component and the repair of damaged cells, is a good combination to use. Red light is believed to stimulate cytokine release from various cells, including macrophages, and we also know that it can reduce inflammation, as I've mentioned. Bit of research on this. The first paper is comparison of red and infrared low-level laser therapy for the treatment or in the treatment of acne vulgaris. The study was a single-blinded randomized clinical trial. Patients were aged above 18 and diagnosed with mild to moderate acne, and they were treated with either red, 630 nanometers, or near-infrared, 890 nanometers, on the right and left sides of the face, twice in a week for 12 sessions, and clinically assessed at baseline and weeks 2, 4, 6, and 8. The results of the 28 patients that participated in the study, they found overall that at 10 weeks after treatment, the acne lesions were significantly decreased in the side treated by 630 nanometers, so the red. The energy density was 12 joules per centimeter squared, but this decrease was not significant in the site treated by the near-infrared. So what I would suggest here is that if you're treating acne and if you're using just our equipment, use red and near-infrared, but don't just use near-infrared. Near-infrared will be helpful for inflammation, but unfortunately it doesn't cause that photochemical reaction and the porphyrin reaction in the bacteria. For that you need red and also preferably blue light as well. So here are some of the pictures of one particular patient. This was baseline. You can see the acne at 6 weeks and 10 weeks. I do have some of our own case studies at the very end of today's webinar. Now, how do you approach treatment for these dermatological conditions? For both acne and skin aging, you would go to Wounds and Dermatological, go to Dermatological Applications and choose stage 1. There are 3 steps essentially. The first step is using the red array, 100% continuous wave for 12 minutes duration. The step number 2 is using the near-infrared array, again 12 minutes, pulsing it at 50 hertz or cycles per second at a 50% duty cycle, again for a total treatment time of 12 minutes. Now, with respect to the laser probe, if you're treating, say, just the dermatological, if you're treating just aging skin, there is no need to really use the laser probe, so I wouldn't necessarily use the laser probe. However, if you're treating acne, I would use a laser probe. If you have the red laser probe, definitely use that. If you have just the infrared, then you want to target the most inflamed areas of the acne with the laser probe, only holding it for maybe 3-4 seconds per point. Okay, the next condition is herpes virus infections. Fun facts about HSV is that, of course, we know that they're very common types of infections present at any age, and oftentimes have a lifelong persistence of the virus within the host's body. We know there's 2 strains, HSV1 and HSV2 in humans. These infections are some of the most common types. I guess I just repeated that one, sorry. Following the initial infection and resolution of the lesions, the virus actually traverses and crosses nerve endings of the affected nerve and establishes a state of latency in the sensory ganglia of the nerve. Most commonly, if it's around the face, it's in the trigeminal nerve. So what can happen is you can get reactivation of the virus, and it can be the cause of physical stress, emotional stress. For example, fever, exposure, excessive exposure to ultraviolet light, even immune suppression can reactivate this virus. 60% of all patients in both immunocompromised and immunocompetent, meaning regular, people with normal immune systems, they can experience prodromal period, after which outbreaks develop through the stages of erythema, so redness, and papules, vesicles, ulcers, and crusting over, and eventually the healing is achieved. I'm sure everyone's familiar with these types of lesions around the mouth. The prodromal period is accompanied oftentimes by pain and burning and itching and tingling, and then you'll start to see the formation of blisters, and oftentimes they're quite discomforting to the patient. If anyone's had them before, you know what a pain in the butt they are. So LLT can serve as a suitable alternative to current therapeutic modalities. It can accelerate the healing process, as we well know. It can reduce the symptoms secondary to these infections, and it can even help to manage the recurrence of the outbreaks. Let's look at some of the research. This first paper, entitled Low-Intensity Laser Therapy is an effective treatment for recurrent herpes simplex infection. It was a randomized, double-blinded, placebo-controlled study. They were looking at perioral herpes simplex at least once per month for more than 6 months. And they were looking for recurrence. So in other words, they were monitoring and seeing when these patients had recurrence of their herpes virus. So patients in the laser group received daily irradiations for 2 weeks, so 10 total treatments, whereas patients in the placebo group were sham irradiated. They used red, so 690 nanometers, kind of unusual wavelength. We prefer 660, but 690 is on that upper edge of red. Power density is 80 milliwatts per centimeter squared. Energy density 48 joules per centimeter squared in the 50 patients. And again, if you're not familiar with it, this is what a herpes perioral infection looks like as it's crusting over. Okay, so these were the results. If you look, carefully, at the very bottom is the beginning of the timing, and then you look at the weeks out, 10 weeks, 20 weeks, 30 weeks, 40 weeks, 50 weeks. Every dot refers to a patient that had a recurrence of HSV infection. So if you look at the placebo, nearly all, I don't know what the percentage was, of the patients had recurrences within 10 weeks. Whereas in the laser group, only a very small percentage had a recurrence at 10 weeks. And then you can see 20, 30, 40, 50 weeks out, people started to get the occasional recurrence. So definitely you can see quite a correlation between treating with the red light and helping to prevent the recurrence of HSV. Treatment-wise, you would go to head and neck facial pain stage 1. That is a 10-minute treatment time using the dual 180 or 240 red array. Step 2 being 12 minutes of the near-infrared set at 10 cycles per second, 40% duty cycle for 12 minutes. And you would use the probe again, preferably red, but if you have infrared only, use the infrared set at 40%, so much lower percent power. And again, holding it for a few seconds to cover the most affected region that you're treating. Next is vitiligo. A few fun facts about vitiligo is it's characterized by an acquired pigmentary disorder where you have depigmentation of the skin and the hair. It's considered an autoimmune disease, although there is still a lot of research going into the etiology of this particular condition. They feel that oftentimes it's initiated by stress, and it can even be worsened by exposure to certain chemicals as well. The affected cells in vitiligo include melanocytes, of course, melanoblasts, which are the immature melanocyte, keratinocytes, and fibroblasts. Some pictures, if you're not familiar with vitiligo, is you can see the loss of pigmentation of the skin. Obviously, a lot more dramatic in patients that have darker skin color, but even in Caucasians, it's quite dramatic, the loss of pigmentation in the skin. So there's different types of vitiligo, but there's one specific type that some of the research has been done on, and that's called segmental vitiligo. It's linked to sympathetic nerve dysfunction in the affected areas of the skin, and it's proved to be resistant to most conventional forms of treatment. There has been good research into LLT, and it's been shown to improve nerve injury and generating responses in the melanocytes and melanoblasts to promote repigmentation. One paper that I want to draw your attention to, low energy helium neon. You don't see helium neon very often anymore, but it was one that's still used occasionally. It's usually in the red wavelength. And this particular paper was looking at repigmentation in segmental vitiligo lesions. So 40 patients that have been diagnosed with stable segmental vitiligo were selected. And again, this type of vitiligo occurs in a dermatomal distribution involving the sympathetic nerve supplying the affected dermatomes. The helium neon laser I mentioned earlier, 632.8 nanometers, so that's red, with an average power output of 1 milliwatt, so really low output. The way they did this was they held this laser on one point, and then they literally had to hold it to cover the entire lesions. A really not a effective way of treating. So it's much easier to place a red LED array over an area of depigmentation than using a low-powered laser probe. So it was designed for point stimulation, as I just mentioned, once or twice a week, and the irradiating flux or the energy density was 3 joules per centimeter squared. So here's one of the results. This was a 5-year-old girl who had vitiligo on the right cheek for a year. So on the picture on the left is the initial presentation. You can see that there's trichosis and pigmentation, and you can see spider veins as well in the skin. And then after the treatment, you can see a dramatic improvement. But please note, this was after 174 treatment sessions. So that is a long period of treatment time. Remember that this takes a long time for these melanocytes and for the change in pigmentation. So be prepared if you're going to work with these patients that it's a fairly long treatment plan. Maybe not 174, given that our equipment is a lot more effective, but I would certainly say you're looking at least 30, 60 plus treatments depending on the severity of vitiligo. Okay, hypertrophic scars and keloids. Example on the top left of a hypertrophic scar, and the bottom a quite dramatic keloid scar after surgery to the Achilles tendon. A few fun facts with respect to hypertrophic scars and keloids is that they are benign, fibrotic skin lesions, and they usually arise following surgery, trauma, and so forth, and tend to be very difficult to remove. There's fibroblastic proliferation and excessive collagen deposition, and these are the main characteristics of these lesions. There are imbalances between the rates of collagen biosynthesis and degradation superimposed on the individual's genetic predisposition. These have been implicated in the pathogenesis of keloid and hypertrophic scars. So in other words, there's a hereditary genetic component, and it affects essentially the synthesis and degradation and production of collagen. It's been recently suggested that there's poor regulation of something called transforming growth factor beta 1 or TGF-B1 expression, as well as interleukin 6, which is a chemical inflammatory mediator. And it has been noted that the inhibition of interleukin 6 pathway and or TGF-B1 expression could serve as a potential therapeutic target. And guess what? Low-level laser therapy has been known to affect both the PDGF and TGF-beta1 as well as interleukins. So it's interesting that these have all been measured in vitro and have found that LLT may be an alternative to currently available therapeutic options to help with keloid and hypertrophic scars. Here's a case study out of Montreal, Quebec, by Dr. Barolette and Annie Boucher. They had 3 patients, so it was a case study, ages 27 to 57. They had hypertrophic scars and keloids, either due to acne or surgery, and they participated in this case series. One scar was treated daily by the patient themselves with a home system using a non-thermal, non-ablative, near-infrared 805 nanometer 30 milliwatts per centimeter squared for 30 days. So daily 30 days, that's 30 treatments. The results, there was significant improvement with respect to the near-infrared treated versus the control scar. There was no significant treatment-related adverse effects were reported. They concluded that there was possible mechanisms involved, including inhibition of that TGF-B1 expression. And they suggest further studies, clinical trials, to help look at this type of treatment. And here you can see, this is one of the cases, the infrared treated baseline, the control baseline, and you can see the post-treatment, really nice resolution of the scar post-surgery, and really nice resolution of the keloid scar. Okay, moving on to psoriasis. Some fun facts is that, of course, it's a chronic and recurrent inflammatory skin condition that affects up to 3% of the population. Again, etiology not well understood. There's systemic effects going on, genetic, immunological, and perhaps even environmental factors. If you haven't seen psoriasis, this is what it looks like. Very dry, raised, kind of silverish, reddish lesions, usually on the extensor surfaces of the extremities, but not always. This particular paper looked at 9 patients that were diagnosed with psoriasis. They all had chronic psoriasis, and they were proven resistant to conventional treatments. They were treated sequentially with LEDs. Notice a lot of these studies are using LEDs and not lasers, by the way, using continuous wave, near infrared, and red. 20-minute sessions, so again, a little bit longer. You notice that our sessions are fairly long as well. They treated for 4 to 5 weeks with 48 hours in between sessions. And you can see the energy density. The results, all patients completed their LED regimes, and the follow-up periods were from 3 to 8 months, except in 2 patients who were lost to follow-up. The clearance rates at the end of the follow-up period ranged from 60 to 100% satisfaction, which was universally quite high. And they concluded that there were anti-inflammatory effects of this LED energy at the infrared and red wavelengths, and it seems to really hasten and improve the wound healing of psoriasis lesions. And here you can see one sample picture of the psoriasis patch was showing dramatic improvement pre and post 8 months out after the treatment. Treatment-wise, we do have a protocol for psoriasis. So you go to Wounds and Dermatological, psoriasis stage 1. That treatment is 5 minutes of red, continuous wave. Near infrared is 5 minutes, 10 hertz, 50% duty cycle. And using the probe, very low percent power, 30%, just a few seconds over each of the most affected areas of the psoriasis plaques. You don't need to do all of the areas, just the most affected areas with the laser probe. Okay, I'm going to finish off today because we're actually pretty much running over time. A few case studies that we've done in our clinic here. You can see presentation of acne October the 2nd and 11 days later. This would have been about 4 or 5 sessions. You can see quite a reduction of the acne, the redness and the inflammation. Remember, we're just using red and near infrared here. I do also suggest that getting blue light would also be helpful as well. And I'm trying to get blue light into our system for that as well. Psoriasis, a very severe case with respect to the entire body. This is the torso. You can see the initial presentation, May of the 11th, June the 3rd, and then July the 14th. And you can see really nice reduction in the psoriasis lesions. Another dramatic use, this patient was prescribed a home system as a student. She wasn't able to come in for treatment, and you can see about a month and a week out, a nice improvement, although not resolution yet, of the psoriasis of the torso. One condition I didn't mention, but you can treat post-pregnancy striae or after pregnancy of stretch marks, and you can see this is 3 treatments over 8 days as well. All right, well, thank you very much for listening in today. Our next training here in Toronto, if you care to join us, is Friday and Saturday, April the 12th and 13th. If you want to register, just go to our BioFlex Laser Therapy website to register. The next webinars in April the 11th is on proposed mechanisms for transcranial laser therapy, treating things like concussion, post-concussion syndrome, those kinds of things, using low-level laser therapy off-label use. And also the next one after that is in May, laser therapy for nerve repair. So thanks very much for listening, and I'm going to see if you guys have any questions for me today. Okay, so I have a patient, I have a question here. Have we treated Ehlers-Danlos syndrome, and what would the treatment protocol be? We have treated a few of the patients. It's a really complex syndrome, and this is from Marie. Marie, I would suggest that this would involve an email. If you could email me at david@bioflexlaser.com, and I'll talk a bit more about that challenging complex syndrome. We have treated it. It's certainly not very common, and I'd prefer to do that over email. Another question from Lisa is, with the eye protection on, is it okay if the patient still sees some of the red light around the face? Yeah, I should have mentioned that when you're treating around the eyes, you should always wear eye protection. Using the LEDs never poses harm to the eye. So you don't need to worry about it ever affecting the eye. But if you're using the laser probe anywhere around the eye or the face, I want you to wear the protective goggles. So the small goggles that give you 100% blockout is what I would recommend. Okay, that's it. Thanks very much for joining me today, and hopefully you guys can tune in next week. Take care.